Hello, sir. Welcome, sir. Once again to our Hariohm Academy for discussing about COVID. But now the situation is not that good. Very challenging time. And you are the right person at this time to be asked because you are resourceful and you are updated. Sir,
Not really, but we will just, I'll just share what I know. Not necessarily it should be taken as a complete advice, right?
yes, sir. Yes, sir. Sir, now can you elaborate at what juncture we are into now as a country, as a human race about this COVID, and what do you predict, sir?
Uh, 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 the if you believe the data, it seems to be suggesting that overall the India might be plateauing. The numbers might be plateauing. So some good news, if at all. But the problem with looking at India data is basically we are probably bigger than European Union and US put together in terms of population as such. And the vast space makes it very difficult to get for the whole of the country. Because what I read was that we may be seeing some plateauing and reduction in probably Delhi or Maharashtra, but it may not be happening in places where the second wave is just starting, especially in smaller cities in Tamil Nadu, Sivagangai, Madurai, Tirunelveli, Thoothukudi, Salem. I don't know a lot of places in Salem, but smaller places in Salem will be in. We may have increase in numbers. It's a definite possibility, but the point is we have to be careful in Tamil Nadu, even though the overall India numbers might show some waning downwards.
So this plateauing, at what point of time the plateauing take place? This plateauing take place because of
I don't have a clue about why the plateauing taking place and things like that, because that's very technical. What I can tell you is it goes up and then some moment of plateauing, and then slowly it starts to rise down. Again, it might go down, go up again also. This is not from this pandemic. If you see the early 1910 to 14, 15 influenza pandemic, or the plague pandemic, or the cholera pandemic, everything went in the same trajectory. So it seems that we may have the same trajectory now also. We'll have ups and then downs and then up. So the second wave has to go up and then slowly it has to come down. That seems to be the nature of the disease. But if it has to come down faster, if we take our precautions, if you're distancing and if you are doing the vaccinations, we may come faster downwards.
So if I get up early in the morning and I see that there is a temperature in me, what are the first things I have to do sequentially? Because there are people are giving.
This is very technical for me to say with any confidence, because I don't have the slightest clue about any of these things. But if it is for me, that is what we are talking about today, right? If it is for me, or if it is for my son, if it is for my mother, what will I do, right? So I will definitely get a swab test, because the likelihood ratio, what we call as a pre-test probability, that is, for you to get a COVID at this point of time, the chances are very, very high, right? So I would definitely test for COVID. Probably sometimes it may take 1 or 2 days also to get the results also. In the meantime, what I would ask my or me or you or my relatives, my mother, whoever it is, to be, if possible, to be in a separate room. If possible, this is a big if possible, because it is not possible in many Indian homes to have a separate room for someone, right? If you are in a small village, you can also sit outside. Sitting outside is the best possible. If you have a what we call as in Tamil a thinnai or something like that, that's a well ventilated area. We can sit there. So we want to be isolated until you get a negative test, right? So I would do those things. Again, it is not this is not exactly the science, but this is what I will do, which I think that's what everybody is also telling us to do also at this point of time, right?
Yes.
Also, you look out for other symptoms also, for developing symptoms and things like that, right?
Sir, in case if I'm running temperature and I'm being advised to go for medications and I'm abiding by all these medications, how often I should do the diagnostics? Because nowadays these D-dimers, ferritin, LDH, IL-6, these have spurred up and it's making a big business. So should I go for diagnosis or I should expect for the natural recovery to happen?
No, these are not diagnostic tests. These are probably prognostic indicators
Yes, yes.
for us to know, right, or what is happening inside me and things like that. Because the diagnostic test is the swab test. There is no other
Yes,
test,
yes.
right? Uh, in terms of these other tests, which are the blood work which is done, there seems to be a lot of there doesn't seem to be any consensus on whether these are good, bad, or whether it is helpful or not. Because some people have said that the D-dimer test, which can be a prognostic finder of what may happen to me later on, some people have claimed no and things like that. But I don't have, I'm not the authority to say yes or no. But what I would suggest is these tests are not harmful for you, right?
Yes.
So even if they are asking you to take it, we have to follow. We can't be saying no or things like that. Again, this is for my point, right? If it is happening to me or to my relatives or my mother, my father, and things like that. So I will follow. But at the same time, if it has some risk covers to it, right, I would certainly avoid that. Say, for example, a CT scan. In the early stages, it has very, very little value. A lot of people think that you can diagnose COVID with CT scan. Again, if it is for me, I will never do that, because the scan is a CT scan may be having harmful rays and things like that. So, but the other test, they may not be valuable, but I'm not sure if my doctor tells me what will I do, probably do it. But I'm not sure whether they have any substantial value in terms of treatment. I am not very sure of that.
Sir, what about the preparedness of individual? Nowadays, people are advising a lot of spices, a lot of food modification, protein intake, and all these things. Do you think what science says about these things? If you are consuming all these things, you can resist COVID to a better extent, or you can shield
Uh,
COVID?
Only thing, a lot of people tend to think that if you eat well, you are more fitter. That is a sort of an Indian culture also. We tend to think that a bigger person is healthier than fitter person, if you will. So I am pretty sure that diet alone is not going to do anything. Eating this or that is not going to do anything, because of two things. The immune system does not go up. That is not how our body works, right? So I'm not sure how they think that the immune system goes up when you eat something or things like that. And also the other thing we want to remember, if I drink a coffee, right? I just drank a coffee actually. Um, you feel that caffeine kicking in and you're slightly awake for quite some time. Afterwards, as the what we call as the half-life period, the caffeine goes down, 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 and you go down also. So if at all, if I'm taking some supplement, it is not going to be there for throughout the day. The spike is not going to be there, if at all. I'm pretty sure it is not there. So, but what they have suggested is, if you are doing proper exercise, if you are fitter, then your chances of getting a milder variant of COVID is higher. That is, you will not get a very severe or moderately severe COVID, right? For that, exercise is the only option. Remember, you have to eat well. There is no question about it. But if there is a specific thing to eat, I don't think so. You just eat properly. Again, this is a big problem. Even though we all come from a sort of a middle class, we don't have any problem with buying good vegetables or dal or something like that. But think of people who are sort of low middle class in terms of economics. They are struggling because of the uh, inability to get food, good food, fresh vegetables. All these things are difficult, right? So mm, if you want to prevent COVID in two lines, eat well, probably good vegetables. If you eat meat, eat all those things, but do your exercise. That is the only thing. Well, that's what I read, and that's what I tell all my friends and patients.
What is your take on some medications like the ivermectin, doxycycline, acetral, the remdesivir, steroid?
Right.
What is your
Right. This is not my take. This is not my take. I don't have the slightest clue about medicine. Right. I understand. I'm just telling you to so that people understand and not jump at me saying that you are not fit to talk about that. I am not. I don't have any training in pharmacology. I don't have any training in any of these things. These are information I have collected so that I can be an empowered patient. Right. What I mean by an empowered patient is whatever you are given, understand what you are taking. Don't just take it, right? That's a paternalistic way of medicine. I will tell you the medicine you have to eat it. That is not how medicine should be practiced. So I have learned certain things based on the guidelines and systematic reviews and evidence and things like that. So uh, the, I'll just tell you about two or three things because that's what it's given in India. If you have a mild variant, like as you have, I'm not sure whether I can say that, as you have said about your my friend who has a uh, she is suffering from a mild COVID case. She is at home. Probably a paracetamol might be the best drug, and wait it out. There is no other drug to help you in any way. They give antibiotics, which is a oxymoron if you think that it's a viral infection and they are giving you a antibiotic. It doesn't. I don't know how that crept into, and that doesn't make any sense. In case of other family flu, what is that drug called as? Invertimycin. Am I saying it correctly?
ivermectin.
Right, right. So those have been proven to be uh, of very poor value. They don't have any value in anything. Here we want to understand what is value. That is, if I take that drug, what is the value I get, and what is the risk I have. Any drug will have a cost and a benefit. The cost can be financial cost as well as adverse effects. Anything will be like this, right? There is nothing in the world without a cost and benefit. Now, if I say that some drug is not working that much, what it means is the cost is huge, the benefit is nil or very small, right? So if you take these drugs, the cost is higher because it's very expensive in the first place to take this drug, and getting these drugs. All these things are there. And the other adverse effects are GI tracts can all things can happen to your GI tract from diarrhea and things like that. You should live. If you live, that is a benefit, right? Or you should have reduction in the time you spend in a hospital. These are the two outcomes, not oxygenation or this and that. So these are the two outcomes we have to look for. Now, if you take most of the small drugs, the antibiotics, the Famiflu, this and that, they don't reduce both. They don't reduce hospitalization time, or they don't prevent death, right? So if it is given to me, I would question why you are giving this to me. I am not saying I will not take it. I will ask my doctor, why am I given this? Tell me what is the benefit and what is the cost of these things, right? Because that is how medicine has to work. That is what I want my patients to do. That's the same thing I will also do, right? The next thing is the remdesivir, right? People are queuing up and things like that. So you need to understand about remdesivir. Again, not to be confused with a pharmacologist or internal medicine person. Just what I know, nothing to do with the how the drug works or who to give. I don't have the slightest idea, right? Because that is not my, what is the indication? I don't have the slightest idea. But what I know is the outcomes are, as I told you, two things: whether it can reduce survival. No, it cannot. If you are going to die and if you give remdesivir, it is not going to change, right? That is, your survival rate is not going to reduce because of remdesivir. What it might be doing is, if you are in hospital for 5 days and you recover slowly, it can reduce to 4 days. It can reduce by 1 day, right? So that is the benefit. Now, if you take the cost of it, is people are queuing for 1 day or 2 days in a crowded place, in the platform, standing up. I am not sure that the cost and benefit is that good to find a drug which is not reducing your death rate, and it might reduce 1 day of hospitalization. For that, do you need to spend that much of cost? Uh, if I will not do that, right? And also, that's what uh, every internal medicine person uh, who is who I have talked to or who I asked these questions have also told us, right? So that is about the common drugs they give for uh,
COVID.
COVID. The last drug we will just talk in few minutes, if you just give me, is
Please.
the steroids. Again, don't have the slightest clue when to be given, or who to be given, or when to stop it. I don't have an idea, because again, that is not what I'm trying to do in my life, right? And that is a job of a doctor or things like that. But if I am given, when should I be given? It seems that it has to be given when you have sort of a hypoxia, right? And not as a prophylaxis. That is, it will not prevent you from getting into hypoxia. Remember, a steroid suppresses the immune system, right? It suppresses the immune system. So when the system is fighting, and if you are giving a steroid, it will actually reduce it. So you want to give it after they go into a sort of a hypoxia, not prior. So again, what I wanted to say is, I am not telling when the doctor should give it. I don't have the slightest clue. But if you are a patient, if you are in house quarantine, if you are mildly affected or mildly moderately affected, you may not need that steroid all the time. It may harm you if you take a steroid earlier rather than later, right? So that is the one thing you want to remember. Other things, they will determine when to give you, when to stop it, all those things. But we should not be saying, everybody told steroid is good, why don't you give me? If somebody is giving you, you have to ask them, why are you giving steroids at this point of time? That's what I want to say about the drugs.
Sir, coming to the most important aspect, the vaccination. So, do you think vaccination is the only way out of this pandemic? And how many percentage of people have to be vaccinated for a country like India to come out of this pandemic?
The second question, I don't have the slightest clue how many percentage should be vaccinated to get a sort of a reduction in numbers and things like that. I don't know. But again, whenever I write on Facebook also, I tell everybody, learn about the cost and benefit of a vaccine. Don't go just because I am telling you to go, or your doctor is, whatever, whoever is telling you. You learn for yourself what is the cost and benefit. A lot of people are saying some people have died. Naturally, some people would have died. We don't know, right? But that is the cost of a vaccine. You might get in 1 million, somebody will die, or they will have a huge adverse effect. I'm not saying dying, but they may have a huge adverse effect. So you want to read about what is the risk I am taking if I am taking a steroid, a vaccine, and what is the benefit. For me, it was very, very simple. The benefit is I am not going to die, right? And the other benefit I have read is if I take two shots, even if I get affliction of COVID right afterwards, my chances of getting a severe variety where I will go and search for a oxygen bed or a ventilator, things like that, is lesser. The chances are very, very less, right? So these are the benefits. The adverse effects is, as I told you, I think one in 2,500,000 or something like that, you will have a severe adverse effect. You may actually have a very severe adverse effect. There is no question about it. You want to understand that. And also, a lot of people have suggested that what we call is a Covishield, that's the AstraZeneca vaccination, may have certain adverse effects, especially in a particular probably your risk is slightly higher, right? But as I told you, you need to go and see what is the cost and what is the benefit and take it, right? A lot of people have said that somebody has died. I know for a fact two people have died after getting both the vaccines. One I have said, read it in Hindu paper. I think he was a police from Bombay or something like that.
Yes.
I think, I'm not sure. It is right. So the first thing is I don't know what drug he took, what vaccine he took. But even if I assume that I took Covishield, he might have also to Covishield. That's all right. But remember, until today, probably we have put what 15 crore we have put. Am I is that number true or false? I'm not sure, but it should be in that. Probably one shot we would have put for 10 crores or something like that, right? The whole of India, not for Tamil Nadu. I think Tamil Nadu we have around 69 lakhs we have put, right? In that number, we have two deaths, right? That happens. You can't say you only told us to put the vaccine. See, somebody has died. That is the nature of it, right? Say, for example, what I tell people is, they ask you to wear a helmet, right? It prevents you from getting an head injury. But you can see some people after wearing a crash helmet, you will sort of get a huge head injury. Sometimes you may die, you may have a huge head injury also. But that doesn't mean that you will say that I will never wear a helmet. That is not how these things work. That is not how medicine works. You will have a cost and a benefit. So check for your cost and benefit, right? Don't tell other people, don't do it. That is one thing I would ask everybody to do. Ask them, if they don't want to do it, just tell them go and clear your doubts. But don't tell them you should not do it. That I think is increasing in our country, especially among uh, people who have studied medicine, not doctors as such, but some of them also. Um, but from physiotherapist to nursing. A lot of people are confused with these things, I suppose. So that's what I want to talk about, say about vaccines.
Yes, sir. And I would like to add one more thing, sir. Psychologically, when you're talking to a doctor, when he asks you, have you taken vaccines? If I say yes, I have taken vaccine. The moment he says, then don't worry, you will be fine. That gives an
Yeah, exactly.
yes, because this stress does a lot of things in these conditions. Sir. When my parents were affected, I was roaming like I don't have at least any little clue about this condition, and as if I am a layman, there is a mental block that happens. So, what stress can do to the caretakers and to the patients at this juncture, sir, and how to overcome that in your personal experience?
I think that is one part we are missing about. We say that reassurance in back pain, OANE, but nobody is talking about reassurance in COVID, right? If you're a mild variety, I think the biggest or the most important person to be talking to them should be counselors. But I am glad there is a small group of volunteers who are doing that in Chennai. I have put that in also in the Facebook
Yes,
also.
yes,
One of my sister-in-law, who is also part and parcel of that team also, they are also doing telecounseling also. So it is vital for, if you have a mild variety, right, uh, to have a good reassurance. And I think the doctors, and if you are again, we are not eligible to, or the perfect person to do it, but you can give a moral support. Don't worry, this is just a mild. When we are keep on monitoring, ask them to eat properly, whatever problem it is easy for us to say that kind of things, rather than telling you, why don't you go there, people go ordinate to the that hospital, this hospital. That, I think, should not be uh, that should not be our instinct. Our instinct should be, if it is mild, right? If it is there for 10 days and it is not reducing, and suddenly the slowly it is creeping into the 80s, right? From the 95, it's going 94, 93. Then you can start searching for an hospital and things like that, or you need to have probably you may need to have a hospital bed also. But other than that, that I think is vital. The other thing I have also learned, not again, as I have not gone to any COVID ward also, so I don't have a first-hand information in any of these things. But my friends are working in ICU, and they have said that they are so afraid, that is the patient as well as the therapists and doctors, because no, you are just lying down and somebody is dying in the next bed, right? And you are lying down throughout the day without anybody telling you anything properly, or giving you consoling messages, or whether you are getting better down, all these things. So again, I think if you are a therapist, nothing to do with anything, if you are a therapist and if you are in an ICU, talk to the patient, every patient you have. Again, this will look like as though I'm patronizing somebody who's doing a great job in ICU, and I'm sitting at home, right? But I'm just telling you, I'm not asking you to follow it or anything, but I'm just telling you what patients have told us or told other people, and I'm just projecting this because you are asking me, right? Just ask them to talk with them and tell them that that's all right, we can get better tomorrow. Or if they are actually getting better, make them better. I know some of the therapists have gone and given them some books to read in the ICU, because they are just lying down from morning till evening without anybody to talk to them much and things like that. So if it is possible, I would suggest that as the
yes.
one of the things which we have to do.
Yeah. Sir, what about the proning, sir? They say that in proning, ventilation improves, and some of them suggest at least 16 hours, or some suggest a sequential side lying, prone lying, and supine lying. So, what is your take, sir? What science says about proning?
Uh, right. Sorry. Um, so we know that proning seems to help in oxygenation, at least in the short term. Whether it is, again, as I told you earlier, there are only two outcomes in COVID. Either it is reducing hospital stay or whether it is decreasing your mortality rate, chances of dying. Again, I am not sure whether we have an outcome which measures these two at this point of time. But in the short term, it seems to help in oxygenation. Um, so out of all the things which is given, clapping, hacking, those kind of things, they don't have much of evidence, even in non-COVID patients, leave alone COVID patients. Provining is one thing which seems to have some amount of evidence for uh, improving oxygenation. Again, not for whether it will prevent death or whether it will increase your chance of discharge earlier. We are not sure at this point of time. But because it seems to be indicating that it's good for your oxygenation, we have to do it, right? Remember cost and benefit. The
Yes.
benefit is huge, the cost is nothing. You just have to put them in prone. You are not spending
Anything.
even a single paisa in that, right? So you should be doing that.
Yes, sir. Yes, sir. Sir, what about the chest wall expansion exercises and all other breathing exercises as such people do? Uh,
Again, the benefit is unclear, but the cost is very, very less.
yes, we
So
can.
it's all right. We can keep on doing it. But remember, out of all the things which we have been taught in cardiophysiotherapy, I would suggest proning should be not I am suggesting, that's what people are. The evidence is slightly indicative in that direction. Not very clear at this point of time. Probably we will find out later on. But we should have proning, and then probably other techniques can be incorporated into that.
The patients who are healing from COVID, who have come out of COVID, some say around they are in the 9th or 10th day and their saturation is fine and they didn't have fever for nearly 4 or 5 days. Can they start with mild exercises, activity-based exercises? How they should ramp up? What should be the parameter to be monitored when they are ramping up their exercise?
Right. Again, I can't I can't give you specifics because not my purview. But I'll tell you two or three things which can you be used as an indicator, and you can. Um, so one of the guidelines, if I remember correctly, in WHO guidelines is you have to walk 5 minutes thrice daily as you are slowly recovering.
Okay.
You start with 5 minutes morning, 5 minutes evening, 5 minutes afternoon, something like that, and slowly you increase your the timing and things like that, right? How exactly I can't say that at this point of time. I also don't know also, right? But that is the idea. You need to slowly ramp up the things. Uh, from what my friends have told me, they also do certain amount of if you are in a oxygen bed or if you are in COVID ward without oxygen, but you are in the cusp of getting into an oxygen bed or something like that. They do some sit to stand test to find out how the oxygen is and then measuring it and see how stable it is. Then they sort of make them do some activities. But if you are recovering after 1 week or 2 weeks and they have sent you back and your oxygen is stable, you need to start walking morning, afternoon, evening. Again, gradually, not overdo it also, because it seems that we are in a long haul if you have COVID, especially moderately if you're affected. It may take long time for you to get the whole thing back.
So the IgG test, what people do to find out the antibodies for COVID, if it is more than 15 people are donating plasma, and do you say that if the IgG is more than 15 or 20, around 20, we can be pretty sure that we won't get COVID?
I don't know about those tests, but what I can say is that uh, it looks very it looks good when you are donating plasma and you're thinking that I am saving somebody. It's been proven how whatever amount of the antibodies you have in your blood in the time of donation, it doesn't seem to work. There is only one study which was done in a sort of a complicated manner, which had some benefit, but that cannot be replicated in our hospitals, because they just get a donation and they give it to you. So plasmapheresis again, it's a bad treatment. Not only a bad treatment, it may be actually a harmful treatment also, because uh, it might produce resistance or variants in the virus. We are not sure, but I think some of them have indicated that also. So plasmapheresis is no in terms of evidence.
The next question for the caretaker, sir. If in case if I have a patient at home, the patient is also wearing a mask and I am wearing a double mask to protect myself. I'm going and serving that person. Am I vulnerable to COVID? How, like in case, what I'm asking is that atmosphere will be spreading COVID? Like, is it airborne now or something like that? What is the precaution? In case, even
Right.
if I'm holding physiotherapy clinic, if I'm getting patients, definitely everybody is going to wear mask. But is it safe?
Now, it seems that the COVID is airborne. So a lot of people have, even the WHO started saying that now, and the COVID is airborne. So if you are in a clinic, I'm not sure about the caretakers, because we don't know when they are shedding and things like that. But I think it's true for everything anyway. Um, N95 masks, that kind of respirators, are your best bet for reducing the risk. Remember, there is nothing called as zero risk, right? It's reducing the risk. So wear a respirator, even if your patient is not wearing any proper mask, have mask in your clinic and just give it to them if they are not coming with a proper mask, right? At least if they are coming with a cloth mask, what I would suggest is give them a surgical mask, and then on that ask them to wear the cloth mask, right? If you are opening a clinic, or if you are looking at a
Sir,
windows may not be as ventilated, right? So the risk of transmission, because it's airborne, if it is well ventilated, then the risk is lesser. It's not absolutely no, but it is lesser. That is why I would also suggest, if you have to go shopping, shops where you stand on the platform, or if the seller is also on the platform, this is your chances of getting COVID is very, very, very small from that person. There are two things I would suggest if you are opening your clinic: have well ventilated room, and wear respirator kind of mask. One of my friends, Srinivasan from Madurai, also told me, pedestal fan and face fan in your room and pushes the air outside, which I think is a wonderful idea, especially if you have a sort of a smaller room with limited.
sir, your audio is.
Am I
Sir, there is a lot of stoppage, sir. Like your video is stuck.
audible now?
Yeah, now it is audible, sir. But your video is stuck.
Do you want?
Sir, not an issue,
Is
sir.
it all right now?
Yeah, now that's fine, sir. Now that's fine.
I'll just repeat what I have told, right?
Yeah. To have a
I sorry.
to have a
Go
pedestal
ahead.
which can flush the air out so that the chances of
Correct.
yes, okay, so more of exhaust fan sort of thing.
Correct. That especially if you have only one window or something like that to open, or just buy a exhaust fan. That might also help. And there are some filters they have said out, but I have looked into that filters. It's very, very expensive for us to buy those kind of filters and keep it in the clinic, right?
Yes. So last question, what is your prediction on this COVID, how it is going to, how long this is going to take for us to come out of this? Just out of your scientific prediction, I'd like to say.
No, nothing. I don't have the science to say any of these things. I don't have the slightest clue about any of these things.
So with the data, whatever data we got from the previous,
Because it seems to be two things. One is slightest clue how they are doing it or things like that. But it looks like September. This is just a horoscope prediction, nothing to do with science. I think in September we will be better.
better. Okay, fine. So that is very good news, sir. At least by September we will be fine. What are the measures? The last question. What are the measures you expect the government to do? Because we don't see a real push. Because my parents were affected, and I was communicated by the corporation 2 days later, and the label was struck in my home 2 days later. And there are people calling me every time, but almost everybody is an amateur and they don't know what is exactly COVID, and they just ask, "What? How is your fever?" If I say she's having more fever, can you give me a bed? They are also not able to provide it. It's just a formality talk what they do. And what best can be done from a government point of view, sir? Where we are lacking?
Right. And at this point of time, I am not sure any government, even though everybody knows that I am very critical or hypercritical of most of the governments, especially central, whether it is Congress or the BJP government. But at this point of time, I'm not sure they can do more than this. Even for oxygen supply, I was actually angry, but now it feels that it is not that easy to sort of increase oxygen production and the logistics of bringing it to a bed. And then it's not just the beds and things like that. You need nurses there, you need doctors there who have some understanding of what is happening, all these things. So I am not very sure of those things, but I would expect them to increase the bed capacity and oxygenation and things like that. But I would suggest it in a different manner. Even though I want the government to do that, there is no question about those things. Um, in the long run, what I would suggest, even in the short run, because if you take the Kerala model, why it works better, it's decentralized, right? That is, all decisions should not be done by the health minister all the time. Say, for example, if you are in mother of oil area, there should be some amount of not mother of oil, but Kanjipuram district, Salem district. So that kind of decentralization, I think, will help tremendously.
Yes.
But say, for example, as I told you, Madurai or Shivaganga or some other small taluk level hospitals are not going to increase the bed exponentially. That is not possible in most of the places. So what I would suggest is for us to be ultra cautious. We have to be very, very cautious, and not in behalf of the human, but it only 1% is the death rate. That is out of 100, 1% dies, but here we have up to 10 people dying because they are unable to get proper medical care. So you should be very, very cautious. I would suggest getting a vaccine again if you are going to get vaccination, and if you have questions about that, read and find out and ask and find out what is the cost and benefit. Just don't keep on telling you that there is a risk for this. Everything has a risk. If you get on your bed and you are not able to get any medical care,
your voice is struck.
bike, you are at risk to dying to
Yes, yes, sir. Please go ahead, sir.
so so those are the two things I want to finish it off. That is, be very very cautious and safe, right? What I mean by safe is, uh, if you are going out, that's not a big problem. Where you are going is the big problem. That is, if I go out to your home, that is the problem. If I just go out and roam around and then come back, it's not a problem for anybody, because in the if you are in the park or outside, the virus is not going to come and get me, right? So where you're going is very important. So if you're thinking that this is my friend's house, I will go, that I would suggest to be very very wary of.
Yes, sir.
Even if you're meeting somebody, meet then, as you said, if you're above 45, get your vaccination again.
Yeah.
Make your own decision. All this and that. Make your own decision about vaccination.
Yes. Sir, thank you so much for the time what you have spent with us. I
I just want to add only one thing. I am a physiotherapist. None of what I have said is from, it should not be taken as a prescriptive thing. It should be taken as sort of a science advice. That is all. Nothing more, nothing less. If you want more information on that, again, go and read.
Sir, because we don't have the habit of seeking evidence, that is a major issue. And in that scenario, in a shorter span of time, we can't educate people to go up behind the evidences at this.
Right.
So the information what you are giving is going to be very useful for these people, and they will definitely go behind research to gain scientific knowledge from here on. Thank you so much, sir. Thank you so much. Stay safe and stay strong.